Hello everyone, myself Dr. Paritosh Baghel, Consultant Physician, Raheja Hospital, Mahim. Today I am going to talk about mosquito-borne diseases and what happens when a mosquito bites. What are the various diseases you can get and how serious one can get. During monsoons, there is an increase in the number of mosquito bites, there is an increase in the number of mosquitoes, and that can lead to serious diseases. The important diseases which are spread by mosquito bites are malaria, dengue and chikungunya. Other diseases like yellow fever, filariasis and etc. are not very common in our part of the country. The three important diseases which can be very serious are malaria, dengue and chikungunya. Well, not the same mosquito causes all these three diseases. Malaria is caused by the bite of Anopheles mosquito, whereas dengue and chikungunya is caused by bite of Aedes aegypti mosquito. Anopheles mosquito is basically a mosquito which bites in the night time. It breeds in dirty water, whereas the Aedes aegypti, which causes dengue and chikungunya, breeds in clear stagnant water which can be found around your houses, and it bites during the day, especially in the morning as well as in the evening during the dusk time. Malaria, dengue, chikungunya, all three are very serious diseases. How to know that you have got any of these diseases? Well, history of mosquito bite, that should be there. Apart from that, the most common symptoms with which all three of the diseases present with is with fever, and when you get fever with chills, one should think about malaria, especially in this season of monsoon. Fever with chills, body ache, headache, rash over the body, abdominal pain, these are symptoms of malaria, and it can be easily detected by doing a blood test. A simple blood test about malaria can detect which type of malaria it is and what to do about it if in case it is malaria. The most important thing is once you get malaria, once you get these symptoms, start the treatment early, don't delay. Look for the complications of malaria, and the complications could be right from renal failure to liver failure to the malaria going to the head, which is called as a cerebral malaria, and it can cause rapid deaths. Start treatment early with anti-malarial treatment, take the advice of a doctor, and you should be able to get rid of that infection. Dengue, similar symptoms, bite of a mosquito. The mosquito which bites is Aedes aegypti, and it is also called as a tiger mosquito because it has got stripes over its body, and you can make out that it is the mosquito which spreads dengue. It bites during the day. Symptoms are again fever, severe body ache, joint pain, backache, headache. In fact, the other name for dengue fever is break bone fever. If you get these symptoms, get yourself investigated because the complications of dengue are very serious. One can get very sick. They may develop complications like a dengue shock syndrome, dengue hemorrhagic syndrome, where the chances of death or the mortality is very high. Once you have these symptoms, get yourself tested for dengue in your blood test, and if it is there, preferably get admitted. 90% of the times dengue infections are not so very serious, but 5 to 10% of the patients can develop severe disease, and that needs hospitalization. Look out for the warning signs like swelling over the legs, breathlessness, abdominal pain, decreased urine output, bleeding from anywhere. If these are the things, get yourself admitted. Chikungunya, not a very serious disease, but again spread by the bite of a mosquito. It does not cause death, but it causes a lot of morbidity where the patient complains with a lot of joint pain, body ache, headache, and the pain can persist for a long period of time. There is no specific treatment for dengue and malaria. You have to give symptomatic treatment, and the patient improves when the effect of these diseases wanes out. Thank you so much.